whenever the patient comes to you, सबसे पहले आप क्या चेक करते हैं क्या इसकी root cause है of getting such heart diseases?
Risk factors depend करता है कि how many risk factors person is carrying, family history. आपके parents को heart का problem है, आपको heart का problem होने का chance बहुत ज़्यादा है.
Example 10 patients देखते हो तो 10 में से कितने patients ऐसे होंगे जिसको high cholesterol या dyslipidemia होगा ही होगा.
अगर हम लोग 10 लोगों का एंजियोप्लास्टी करते हैं तो 6-7 लोगों का कोलेस्ट्रॉल बहुत ही ज्यादा होता है, 2-3 लोगों का थोड़ा ज्यादा होगा. These are very uncommon category of patients where lipid is entirely normal and patient is having heart attack.
Have you seen difficult case which you have found to be a very hard nut to crack related to cholesterol or lipids?
I still remember a young person, 32 years old. He was having a chest pain which was not very typical, but his ECG was showing some change. And then he produced me a report, LDL, which was showing 3320 LDL.
Okay, and then when you talk about the symptoms part of it,
so there is no symptom of high cholesterol.
1 in 5 people will die because of the cardiovascular disease, which claims more than cancer and chronic respiratory disease combined. Yet, 80% of the heart disease and stroke cases are still preventable. That is why every 29 September, we celebrate World Heart Day to raise awareness on heart disease and to make you feel the importance of taking care of your heart. And this World Heart Day 2025, the theme is Don't Miss a Beat. Loved ones around the world are losing out on their time which they should get to spend together due to early deaths from CVDs. That is why let's go and tell the world that don't miss a beat. Today on another episode of Beyond the Pill where health meets conversation, I am your host Dr. Chetna and we will be talking about lipids, often known as cholesterol by many. So to help us understand this better, joining us today is Dr. Dilip Kumar. He is a consultant interventional cardiologist, device and structural heart expert practicing at Manipal Hospital, EM Bypass, Kolkata. So let's welcome doctor on our show today and understand from him that why low is better when it comes to lipid and why it's important to make the right choice to manage your cholesterol. First of all, welcome to our show which is Beyond the Pill. तो हमारे पूरे शो का और ये कैंपेन का ये एजेंडा है कि थ्रू वेरी इंपॉर्टेंट डॉक्टर्स लाइक यू वी वांट टू स्प्रेड राइट मैसेजेस टू आवर पॉपुलेशन. क्योंकि आजकल ऐसा है कि सोशल मीडिया में काफ़ी wrong information circulate हो रहा है and people are actually following it and you know काफ़ी trouble create हो रही है. So firstly thanks a lot कि आप टाइम निकाल कर हमारे शो पर आए.
Thank you. So and thanks to Mankind for promoting awareness for I think this very interesting topic and discussion which we are going to have.
Yes, and I feel no one better than you could be a guest for us. So just to start with, I just want to understand what kind of patients do you see on a regular basis and then where exactly can people find you?
So I am a cardiologist and to be more specific, I am interventional cardiologist. I do angioplasties, pacemakers, devices like CRTs and towers and appendage occluder devices. And I work as a director of cardiology at Manipal Hospital, CM Bypass.
Okay.
And I see mostly cardiac patients who have chest pain, who are having syncopal episodes, who are having shortness of breath. So ऐसे patients आते हैं हमारे पास.
तो जैसे कि अभी आपने जो as an interventional cardiologist आपने इतने बड़े-बड़े procedures का नाम लिया, they sound very the big names like are difficult to understand also. लेकिन इनका prevalence कैसा है? Like कितने patients हैं जो actually are going through all these things?
Since we have a reputation of doing intervention, for a normal cardiologist clinic and our cardiologist, our clinic, they have got some kind of different category of patients who come to us.
Right.
50% patients are referred patients who have you require intervention, like someone who requires an angiogram or a pacemaker or CRT device or a tower, they come directly to us. So essentially, अगर हम पूरे दिन में 40 पेशेंट देखें तो 8 से 10 लोगों का कुछ न कुछ इंटरवेंशन हम लोग एक दिन में लिखते हैं.
That's a big number.
Big number. And my hospital, does around 800 procedures in a month.
What?
800 procedures in a month.
Oh my God.
So it includes diagnostic as well as the therapeutic operations. And I do around 150 to 200 in a month. So daily what we see, 30 patients, so 5 days a week. So it boils down to that number. So 7 to 8 patients, they do require intervention out of 30 patients who see us.
So whenever the patient comes to you, सबसे पहले आप क्या चेक करते हैं क्या इसकी रूट कॉज है ऑफ गेटिंग सच हार्ट डिजीजेस? in today's life?
Mostly risk factors depend करता है कि how many risk factors a person is carrying. So सबसे important risk factor जो हम बोलते हैं वो है family history.
Okay.
अगर आपके पेरेंट्स को हार्ट का प्रॉब्लम है तो आपको हार्ट का प्रॉब्लम होने का चांस बहुत ज्यादा है.
Okay. Okay.
So the biggest risk factor what I feel is your family history, the genes with which you are born. Second is risk factors like diabetes, hypertension, and most importantly for cardiac problems, lipid disorders, dyslipidemia.
Yes.
So dyslipidemia जिसका लिपिड प्रॉब्लम ज्यादा है, लिपिड जो बैड कोलेस्ट्रॉल, गुड कोलेस्ट्रॉल, सो उनका जो रेशियो अगर ऑल्टर्ड है, हार्ट के प्रॉब्लम होने का चांसेस काफी ज्यादा है. एंड देन देयर आर सम एक्वायर्ड प्रॉब्लम. समवन इज स्मोकिंग, समवन इज चेन स्मोकर.
Okay. Okay.
And someone is obese. So obesity, smoking, these are modifiable risk factors which are also important.
Okay. So अगर आप 10 पेशेंट्स देखते हो तो उन 10 में से कितने पेशेंट्स ऐसे होंगे जिसको हाई कोलेस्ट्रॉल या डिसलिपिडेमिया होगा ही होगा?
So ये बहुत बहुत ही अच्छा क्वेश्चन है. अगर हम लोग 10 लोगों का एंजियोप्लास्टी करते हैं तो 6-7 लोगों का कोलेस्ट्रॉल बहुत ही ज्यादा होता है और 2-3 लोगों का थोड़ा ज्यादा होगा. और कुछ एक these are very uncommon category of patients where lipid is entirely normal and patient is having heart attack.
Okay.
So, although you
Okay.
can get this,
Okay.
but majority of the patients they have high cholesterol.
So today everyone is just talking about controlling the cholesterol or improving the cholesterol. In fact, I have seen people also talking about Indians have slightly higher cholesterol level. So even if it is crossing the borderline, you need not worry. It's okay for Indians.
No, it's not. It's not at all a kind of a correct way of thinking. See, we are not a very blessed kind of society or a kind of population in world. So we are rather cursed with high chances of having heart diseases.
Correct.
And we are genetically programmed like that कि हमको हार्ट डिजीज ज्यादा होगा और मैलिग्नेंट होगा. सी आई वाज इन नेदरलैंड्स एंड आई यूज्ड टू सी पेशेंट्स कमिंग इन देयर 70s 80s.
Okay.
And now in India we see a decade earlier. So
Yes,
same
that is
kind of
true.
disease which we find in 70s 80s in UK and Netherlands and Western countries, in India we see in 50s and 60s. So a decade earlier we get
Correct.
the same kind of
Correct.
disease, and we have smaller vessels because we are genetically smaller in weight.
Stature, yeah.
Stage, हाँ, so the body surface area is lesser.
जी.
Vessels भी छोटे होते हैं.
Okay.
Coronary artery 4 की होती है, 4.5 की, हमारे यहाँ 3-3.5 की होती है जनरली. तो और वो malignant disease ज्यादा diffuse atherosclerosis होगा.
Okay.
So
Okay.
we have a very high chance of bad coronary artery disease, and treatment भी वैसे ही है हम लोगों का. So we require to adhere to protocols more strictly.
Strictly, exactly.
We have to hit cholesterol, harder with the drugs and everything which you have, and bring it to cholesterol level which is recommended very soon, very early. This is the only way we can be at par.
Okay. Okay.
In prevention of cardiac diseases.
So when we talk about family history, even if one of the parent is having it, or even if they're developing it later in their life, is it still possible that the next generation will get it?
Next generation will have a gene which decides everything. So first generation who is working on drugs and all, so this is for them.
Okay.
Next generation will be born with set of genes, and it will evolve, and the phenotype will be similar. And then you have to, and the next generation has to work for themselves. So a good work of one generation is not going to pass on to the next generation.
So they have to. So when we talk about cholesterol, is it that it is something which is in our hand, or now that we are understanding ki it's also having some genetic role to play?
Yes.
So people might think just getting carried in the gene, what am I supposed to do it for that?
Yeah, so this is both factors are playing up, but it is just a reverse way. Mostly your gene decides your cholesterol level, and then also when you are eating more and you are not conscious about your diet and all, then this will be added on, and then the cholesterol level will be very high. So both the factors they play a role.
So in your such a so many years of practice, have you seen any difficult case which you have found to be a very hard nut to crack related to cholesterol or lipids?
I still remember a young person, 32 years old only. He was having a chest pain which was not very typical. So I thought, I think he is complaining of functional chest pain. Many patients come here, their chest pain here and there, and they are all okay probably. So he was not giving a very clear-cut history, but his ECG was showing some change. His TMT was abnormal, and then he produced me a report, the LDL, which was showing 320 LDL, 320.
Oh.
LDL, the normal range is something around 118 to,
yes.
yeah.
Huh.
And his was 320.
My God.
And then it compelled me to do an angiogram. I was not, clinically with symptoms, it was very vague.
Okay.
And when I did the angiogram, I found this gentleman had 3 vessel disease. All arteries were diffusely diseased. And I was really I had a face loss because I had told his wife that, come on, he's, functional and all. And then I told him, no, he's a very bad disease and all. So she was saying, you were telling me, very early. A while back, he doesn't have any problem. Now he's saying he's severe problem. And he refused bypass surgery. Then I had to do intervention. I put 7 stents in him. Because I told him, we go for bypass surgery, you need to take cholesterol, multiple drugs, also some injections, because your cholesterol has to come within 50, 55.
Yes.
You are a familial dyslipidemia, and it requires multiple therapy and diet, lifestyle change. And to save your life, you need to revascularize. Then at 32 years, he was, no, my life will be totally gone if I have scar chest and all. So I had to put 7 stents in him, and then he still comes to me, and he's still doing well. And touch wood, he's also maintaining cholesterol level.
So
he's on injections.
He's on injections. Okay.
Yes, injections is taking the inclisiran jabs now.
Okay. So in this case, that he has to really land up to your hospital with blockages, I can say. In such case, if the person knew that I had some family history, wouldn't he be more vigilant about the symptoms that he must be facing?
Absolutely. So if someone has a family history of cardiac disease, someone premature death in their family, so what we are doing, we are promoting awareness.
Correct.
So we go to print media, we go to digital media to just tell them, everyone key screen.
Correct.
Screening is the crux.
Correct.
And it should be as early as 18, 20 years. You should check your lipid. You should check your blood pressure once. And this medical camps, why are we doing medical camps? To get a person who is prone to having cardiac problem, who is a hidden problem is there, like dyslipidemia and hypertension, we can pick them up and we start working on that.
Right.
Before they land in these scenarios.
Yes.
So I'm very sure, although he denied a family history, but maybe his uncle, father, there was something.
Yes.
320 LDL, it doesn't come, from sky. It must have been there in genes.
Without any.
So if he had screened earlier, he would have gotten drugs and injections, and I can't say you could have avoided the angioplasty and disease, but disease could be less severe.
Yes, that's for sure. And so without any other bad habits like smoking and drinking, he was having the cholesterol up to 320.
320, yeah. 320. So this is how familial dyslipidemia presents.
Okay, and then when you talk about the symptoms part of it?
So there is no symptom of high cholesterol. There is no symptom of high cholesterol.
Okay.
Symptoms will come if high cholesterol is leading to a cardiovascular problem or a cerebrovascular problem, or kidneys are...
Heart attack is the only symptom.
Heart attack, brain, stroke, kidney involvement. So see, what a bad cholesterol will do. It will promote atherosclerosis.
Yes.
So entire vascular tree will be involved.
Yes.
So the vascular tree, the heart vascular tree will cause heart attack. Brain vascular disease will cause heart stroke. Kidney vascular disease will cause kidney dysfunction, renal failure.
Correct.
Lower limb, the patient will have a limb ischemia, claudication. He may require amputation.
Correct.
So this is the reflection of the atherosclerosis symptoms.
So when we look at cholesterol and when we see the cholesterol in the reports, it's just a small name with this very small unit. But when you look at the impact that it causes, if not kept under control, that's...
Yes. It's a humongous, bad effect of this LDL. And we are now working on some other markers which can be more reflective. But LDL, as of now, it's a gold standard, and we are targeting LDL. It should be as low as possible.
That is true.
As low as possible.
And what is this misconception about cholesterol that you see in patients now and then?
So there are many patients who come that my cholesterol is normal. I got a heart attack. How is it possible? So this is not only the risk factor.
Right.
So this is one of the risk factor, major risk factor. But you have another risk factors also. Someone who is diabetes, they have also being a normal LDL, but still his procoagulant mechanisms are there. Atherosclerosis can be there. Hypertension, so smoking. So these risk factors still play up. And even if you don't have any risk factor, still we are human being.
Correct.
So we are bound to get some disease, and
Correct.
it can happen to you. Heart attack can happen to you.
That is true.
And this is a very common question. I just say, and I answered them in this way. Suppose 20 people are smoking, 100 people are smoking. So out of 100 these smokers, 20 will have heart attack.
Correct.
If 100 non-smokers are there, how many of them will have heart attack? 5.
Nice.
So this 5 will say, I'm non-smoker, I have got. And this 80 will say, oh, smoker, see, I'm smoking, nothing is happening to me. So this is absolutely the same kind of logic works here. So they increase the chance, but they are not the only factor. And the chances of having heart attack is higher in these patients.
So how do you counsel patients? Say some elderly patient above 50 has come to you with slightly high cholesterol level, and the person is having a fair enough diet, like eats all homemade food, but is regularly drinking or maybe smoking. Do they really accept it as a risk factor? I mean, how can you convince them to stop your bad lifestyle and take the statins or take the medication that is required for the cholesterol?
Yeah. So I tell them that these are your mutual fund investments. So you are spending now, but you will be really relieved after 5 years, 6 years. So if you continue with your lifestyle and cholesterol is in higher range and it's getting higher, then you will feel nothing for next 5 years, 6 years. But then everything will come along simultaneously. Maybe your brain problem, your heart problem, your kidney problem, they will all be simultaneously affected.
Correct.
And then you will not have anything to fall back on. So this is the time. So if you spend now, you will get a dividend later on. So this is just like your saving money and putting it in mutual fund. And most of the people, they realize if we explain them with a little time and with some examples, they get back to their normal good lifestyle. And we have kept counselors.
Yes. I feel counseling is very important. Yeah.
Patient goes to a dietitian.
Right.
The same thing is hammered by a counselor. So with 2-3 people saying same thing, it affects. And if someone is even then coming up, then their family members.
Yes,
so the final option is instigate
emotional blackmail.
Emotional blackmail. I ask the wives, don't allow your husband to come in and they enter your house.
Actually इससे भी बड़ा challenge आजकल ये है कि young people, they have this overconfidence that I'm very young right now, but if you look at them, such a bad lifestyle with that continuous smoking, continued drinking, they don't even have an idea that कितने young age में they can get heart attack, and the quality of life can absolutely go down.
And this is a true story I'm telling you. Just now I saw a patient today afternoon. The wife came from Mumbai. The guy he came with a reference of one of my management person, a very senior person. And then he says, okay, so I've come here to have some opinion. Second opinion, I had a pulmonary embolism, 2 years back, and now the cholesterol is high, my HbA1c is high. Then what are you doing? And the wife started telling, sir, he smokes like a chimney and then 50 cigarettes a day. Come on, he's diabetic, dyslipidemic, he had a pulmonary embolism. Still he's smoking. What is he up to?
Yes.
And he's still only 42 years. Only 42 years. I mean, come on, you're 42, you're doing like this. What will happen? So I have just advised him a CT angiogram, both pulmonary and the coronary angiogram, and some tests, and I would advise him to come. But this is the scenario.
Even after facing so much difficulty, it's like you are giving pain to your own body. Still, you need someone else to counsel you about it. Absolutely. I don't understand why.
Yeah.
And as well, like rightly you mentioned that as we talk about cholesterol, it's always like one thing which leads to another. Is it that way that any patient who would have diabetes will also be followed by a cholesterol, then thyroid, and what next? I don't know.
So this is called metabolic syndrome. Okay.
Yes.
So this is a syndrome where these 3-4 problems, they come simultaneously. So obese person has a metabolism which is abnormal, tilted towards diabetes onset. So diabetes and cholesterol, they have got high triglyceride, low HDL in Indian setup, and obviously have high LDL cholesterol, particularly dyslipidemia. So they have got these metabolic syndrome guys, they tend to have this kind of clustering of problems.
Okay.
So the cholesterol problem comes hand in hand with diabetes as well as hypertension and obesity.
Are only targeting obesity, is it that anyone who's lean have really less chances of getting cholesterol?
No, so there is a metabolic syndrome, this is another problem. But a person who is lean doesn't mean that his cholesterol is normal.
Okay.
Or a person who is very obese doesn't mean that his cholesterol will always be high. So these are again the same way which I explained to you earlier. And so absolutely both kind of population you can get. A person can be thin but high cholesterol. Person can be obese. Chances of high cholesterol will be higher, but it doesn't mean that all patients will have high cholesterol.
So I was just reading other day that when you talk about screening of it, because now everything comes down to screening now. So first time, the screening should start from the age of, say, when the person is in 8th or the 9th, maybe childhood. तब से screening चालू करनी चाहिए.
Depends you have family history or not.
Okay.
If someone has family history, early, and this is called opportunistic screening. Like everyone will go to school, you implement this in the school, and the schools are doing.
Yes.
This is where the concept of childhood screening starts.
Okay.
So if cholesterol can be checked in the childhood, blood pressure can also be checked. If someone doesn't have, then this interval can be 5 yearly. For detailed cardiac screening, it takes 35 years. If you don't have symptoms, you don't have family history, then you have to go for ECG, echo, and a treadmill test. But this screening, cholesterol and high blood pressure should be screened as early as possible, right from childhood. And this is opportunistic school screening, health camps that are very important.
Okay, it's a nice word, opportunistic school screening.
Yeah.
So when you talk about, the practice that you've been doing with so many heart patients in so many years, what do you think? Is there like awareness wise, is it better? Or, like patients know exactly कि क्या हो रहा है, क्या नहीं हो रहा है, and they're taking their lifestyle seriously or not?
ये extreme है. कुछ लोग बहुत ही ज़्यादा obsessed है कि and then they are with Apple Watch and then everything. Oh my God, my heart rate went 90 to 95. It's all along 95.
Okay.
I have a cholesterol which is little high, and they come. There are guys who are least bothered. I told you.
Yes.
So balanced people is still in minority.
Okay.
And awareness skill, there is a huge gap. And unmet need of being more and more awareness to be there. So I try to tell people don't be in extreme. And just like hypertension,
Yes.
someone will come with a reading every 3 hourly.
Oh.
So if you prescribe medicine, he will come. That day I had a blood pressure at 12 o'clock, 140, 90. Then 3 o'clock it happened like that. It happened 6 o'clock. But your blood pressure will never be controlled. You're always
stressed.
Stressed. And someone will measure a blood pressure. His blood pressure is normal. Then he stop medicine.
Okay.
After 6 months he will come.
Okay.
So these extremes, similarly, it happens in cholesterol also and heart disease also. But definitely it has improved. Awareness has improved.
Okay.
Many patients, they come with a clear-cut knowledge with them through social media handling, ChatGPT, AI.
Yes.
So very effective.
Yes.
Getting a lot better.
Yes. And then when we talk about stress, how much impact does it have on our cholesterol?
Stress is a risk factor. So stress indirectly causes. So if stress, you feel it's not wrong to smoke. It's not wrong to take alcohol because you are stressed. So there is excuse.
Yeah.
So these things,
correct.
You spirals up. And
yes. So that's how it's linked. Maybe you say stress, and then for relieving stress, you are taking support.
Eating and or something like that.
Okay,
So
that way.
Indirectly, it affects you.
So what other than medications does patient need to do to keep the cholesterol in track?
So lifestyle. So I told you lifestyle, diet is crux. And then workout, isotonic exercises. Not isometric, cardio.
Yes,
and then people, they get us wrong. They go to gym and start, taking doing weights and all, and they come with a sprain and chest pain. They get confused. Heart attack ho gaya.
Oh God.
So these lifestyles, and then drugs are very effective nowadays. And we have some injections which can be given 6 monthly. And in Europe, there is a emerging voice, kind of advocacy that these injections should be applied to common people so that longevity of English guys will increase.
Okay.
So we can live up to 100 years.
Wow.
So this is something, a big kind of mission is working. Good scientists are working.
Nice. That's
and
nice.
they are proposing and they are showing the data that how if you reduce cholesterol earlier, 35-40 years, if you get a target of cholesterol and if you continue, to adhere with this cholesterol level, you are going to give 100 years.
We are about to make an Amrit then.
Yeah. So this is how world is moving, and newer drugs which reduces PCSK9 inhibitors, inclisiran and Dilipkumar, they are very effective and they promise to reduce, and in reality we have seen drastic reduction. And once LDL is less, 3 years back there was angioplasty, again chest pain, again angioplasty, again SCS. So many patients were there who had gone 3-4 procedures over 10 years. They all get jabs.
I mean, we could just very easily say कि इतने 2-3 बारी उनको हो चुका है episode, but then how difficult it would be.
Yeah. But it happens. This is a constellation of risk factors, non-compliance of lifestyle changes.
That is right. Right.
continuing habits and not adhering with the cholesterol level.
And not adhering with the medication as well,
Yeah.
because now the situation is actually quite better, because we see many people, having heart attacks, sudden heart attacks. So there is some fear abhi which has been developed in the population, and they're taking this heart health seriously. But when we talk about taking medication for cholesterol, is it supposed to be taken daily? And if once the patient starts taking it, it has to be taken lifelong?
So cholesterol medicines needs to be continued. There is a phenomenon called rebound phenomenon. So that happens if you stop taking drug, chances of high cholesterol becomes many times more. Okay, this also should be understood by everyone that fittest people like Saurav Ganguly can have heart attack.
Okay.
So it's not like someone who looks fit, who is working, who is playing, who is an athlete, he will not have heart attack. So no one knows about his family history, no one knows what cholesterol level. So
that is right.
Anything can be there.
That
Everyone
is
has to be vigilant about their cholesterol and risk factors, which we just discussed.
That is why like as we were talking, that screening really plays an important role. And with the advancements and with the resources which are available with us in current times, I feel people should take good use of it.
Absolutely.
So on this World Heart Day, what could be like a very important message that you would like to give to our viewers?
So we had discussion on growing problem of heart disease, and it's partially preventable also. Major factors are cholesterol, your family history, which you can't change, diabetes you can control, cholesterol you can work on, hypertension you can control, and smoking definitely you can stop. So change your lifestyle. To conclude, only with these risk factors, two special lines. आप अभी जो खाते हैं उसका आधा खाइए, और जितना आप दौड़ते भागते हैं उसको दुगना दौड़ी भागिए.
Yes.
So that will do 90%.
-2 + 2.
-2 +2.
So we have a small segment which we called as myths versus facts, or maybe some common misconceptions that we see that people are having. So to give them a correct answer and correct information, I would like you to participate in it.
Yeah.
So can we start?
Yeah.
So coconut oil has been very commonly used, at every second house today. So can coconut oil be heart healthy, or does it still push LDL levels up?
It still can push LDL level up.
Okay.
So be wary of more consumption of coconut oil as well.
What do you think as an alternative, what could be used?
So we have sunflower oil.
Sunflower oil. Okay.
We have rice bran oil, mustard oil even. Coconut oil has got very high, comparatively high cholesterol.
Okay.
More saturated fats.
Then ghee to bahut badnaam hai.
Yeah.
So is ghee really healthy or harmful for your heart?
So ghee is having a lot of saturated fat. So better to avoid this, I tell you. Better to avoid this.
There are many people talking about pros of ghees.
Yeah, so grandparents also ghee खाओगे शरीर बनेगा, इसमें नहीं कुछ होता है. So शुद्ध घी. So शुद्ध घी, we respect शुद्ध घी, but with the scientific knowledge, it contains saturated fat and it can be counterproductive. So till 20 years, 25 years, when your metabolism is high, you can take it, but after that, definitely should stop.
Then what do you think raises cholesterol more, sugar or oil?
So here you see oil is full of cholesterol, and sugar will finally convert to cholesterol.
Okay.
So, and at this moment, people, even if not taking oil, sugar they are taking very more commonly.
Yes.
So they should be aware of this fact, and sugar should be targeted very early.
Beautiful answer, sir. So what do you think clogs arteries faster? Smoking, junk food, or lack of sleep?
From worst to little better, smoking.
Okay.
And then junk food. And then lack of sleep.
So smoking is a big no. Yeah. Can high cholesterol really run in families?
Absolutely.
Okay. If you eat home-cooked food, do you still need to worry about lipids?
Yes. So lipid is not something which you are taking. Lipid is also manufactured in liver.
Okay.
Depends on your genetic makeup and the and everything. Formation and manufacturing liver cells will form more and more LDL. And then we'll have high cholesterol as well, even if you're not taking that. Only that doesn't decide your cholesterol.
Does skipping breakfast help to lower down your cholesterol?
Yeah, so there is a concept called intermittent fasting.
Fasting, yes.
So if you are not night you have taken, so as you were sleeping 6 to 8 hours, there is a compulsory kind of fasting happen automatically, and then you are not taking your breakfast. You are taking lunch at 12 o'clock or 1 o'clock, which I do. It's the only thing which I do very religiously. Then your fasting hours become around 12, 13,
Yes,
14 hours.
yes.
So in between, your cholesterol starts burning
Okay.
because there is fat starts burning, and then you get a lesser cholesterol.
Okay. So it's helpful.
Yeah, it's
Last one. Does eating egg every day actually harms your heart?
So it depends the quantity. If someone is eating 3-4 eggs daily, definitely it can harm. And if someone is eating the egg entirely with yellow part and the white part, that's also in higher numbers can be detrimental. But one egg with only white part is not harmful.
Okay. So thank you so much, sir, and thank you for the beautiful answers that you've given to each question. Thanks
Thank you
a
so
lot.
much. Thank you.
So to all our listeners, आज के एपिसोड से हमने जाना कि आपकी हेल्थ आप ही के हाथों में है. So don't wait for the warning sign to make the right choice. After all, it's one life and every beat matters. So if you find our videos informative, don't forget to subscribe to our channel on Instagram. It's One Life by Mankind Specialities. Until then, stay informed, stay healthy.